Hi, I'm Lucy McGrath. I'm the program coordinator at World Telehealth Initiative.
And my name is Bronwen Smith. I am the program associate here at World Telehealth Initiative.
So I always wanted to be in a field that was associated with healthcare, but one of the most impactful parts of the work for me, especially within the communities we work in, is really seeing the dedication of the providers at our program sites. Even just the logistical complications across time zones. Our providers are holding meetings with us at 9 p.m., late into their evening. They are going into the hospital on their few days off to, foster the relationships with the volunteer providers and make sure everything is running smoothly. And it is so clear that their number one passion and priority is the well-being of their patients and their communities. What part of your work with WTI feels most impactful?
Yeah, being able to reach so many people and have our work kind of radiate outwards it leaves a lasting impression on me. And I hope that it leaves a lasting impression on, all of the volunteer providers and our on-site providers, but also the patients and the communities that, really benefit from WTI and the work that we do. We're working with providers that have dedicated so much of their time, in their earlier years going to school and now, serving their community, and to be able to be a resource and also a support system for them, I think is incredibly impactful.
My favorite part of my job, just overall, it is absolutely the human connection. The fact that every single day I get to interact with providers from different backgrounds, different specialties, and different countries who are all united by their desire to help others. That is an experience that I feel so lucky to have every day as part of my work. What kind of impact do you hope to make over time through your work with WTI?
I think the ultimate goal is to eventually just minimize health disparities and to increase access to healthcare, health equity, health equality. These are really important components, and the way to do that is to really focus on education, sustainability, and just ensuring that individuals and communities have access to healthcare and get the help that they need. And I think that the telehealth device, using technology, and especially with its advancements, that will just it will become more accessible. Healthcare will become more accessible to, people in really rural areas or rural clinics and hospitals. And we see that already happening, which it's incredible to watch and witness and be a part of. And so I think, as the years go on, we'll continue to make that impact and reach even more people. Can you share a project or an interaction or moment that was specifically meaningful to you during your time here at WTI?
But I'd say one of the first clinics and recurring telehealth sessions that I was involved in establishing, like from start to finish, was the establishment of our telepsychiatry clinic in Bhutan. One of the first things that I had ever learned about Bhutan was their prioritization and their measure of success based on the gross national happiness, which I always thought was incredible. And so after learning that, when I spoke with a provider in Bhutan during a live simulation training and learned that there are only 5 psychiatrists for all 800,000 citizens of Bhutan, this was quite shocking to hear. And not only is there a limited number of specialists, but they're all at one hospital in Thimphu. So that leaves a lot of other areas in the country, especially those that are hard to reach. It leaves them lacking that specialty care and mental health services, which can be really, really detrimental. And so the establishment of this telepsychiatry clinic between one of the wonderful psychiatrists at Jigme Dorji and then the staff at Eastern Regional Referral Hospital, it made a clear impact right away. Even from the first session that we completed, we got feedback about how that patient, it would have been much more difficult for that patient to get the care she needed. But with the telehealth device, it eliminated travel time, travel costs, and really just got this patient the help she needed right away. And I've been so happy to see that we are continuing to set up more clinics like this. Really just the opportunity to make a real change in accessibility, in a matter of months, has been really, really meaningful.
Yeah, that's amazing.
So as to younger people working in the nonprofit and global health field, what kind of impact do you hope that our generation will make on the world?
Yeah, it's a very, very big question. I truly hope that we're able to bring unity and collaboration and continue to bring that in our work. Previous generations really didn't have technology like we grew up with, where we were able to reach so many people. With the use of technology, we're able to expand at a global level and reach so many people and continuously try to unite. I think it just goes to show that I think the younger generations, they're not bound to just really close distances. We're able to stretch much farther than that.
Yeah, absolutely. And kind of to follow up, do you think that early introduction to technology and limitless aspirations for their career, do you think that is kind of what has been driving our generation towards purpose-driven work?
Yeah, I do. I think because there is so much fulfillment and purpose to reaching people outside just yourself or your community. I think that has been a huge goal and a mindset that the younger generations have had, I think, from a younger age. And what motivates you to keep showing up to do this work?
Something that keeps me going every day and wanting to foster these relationships is just the excitement and passion that I see in the providers we work with and our partners when they realize what telehealth can actually accomplish. And so being able to sit here in Santa Barbara and hear directly from clinicians and nurses and program liaisons overseas about how their hospital, their patients, and their communities are actively improving and doing better because they now have access to specialty support is really powerful. So I'd say the connections that we make and the passion and excitement at the results of telehealth are really motivating me to try and do this work and do it better every day.
Yeah, absolutely. I have to say, the reactions from the providers, or even when we're, training, whether it's the supporting providers or the on-site providers on how to use the telehealth device and how excited they are for the potential of it, it's incredible to be a part of that. It's wonderful to see, their reactions to it.
Absolutely.